Hello, everyone. We're going to give our briefing for today. To be perfectly honest, I hope like crazy that we don't have much to report, but that's not the case again today. We've had several different briefings already today. We did an 11:30 briefing with the Vice President and the President, with all the governors and with all of us on the call. And there was a lot of information, that came out of that meeting, and we surely appreciate our President and our Vice President by having those on a weekly basis, and if not sooner when we need to talk to one another. I have to report that we have had our first death in West Virginia. And I hate this so badly. I mean, it's almost inevitable, but Cathy and I have had all kinds of prayer, especially prayer for all the loved ones of this person that passed away. And we expect everyone, to have them in their thoughts and their prayers, and be very respectful to the families for their private time and all that. But I can't tell you how great West Virginians are doing and how much work there is going on around the clock, especially from our healthcare community. And if you could just always just remember just this, that while if you're looking at just statistics, we could have many deaths and still, as a state, look like we're doing really good, but from my standpoint, a death is not good. And so, but I can tell you this, that if you're feeling the least bit sick, I want you to call somebody and act promptly, act vigilant in every way. Continue to stay at home and continue to heed all the information that we already have given you. There's more and more and more information coming out in regard to just washing your hands, not touching your face. I mean, it seems so simple, but yet those are the things that God above has given us to be able to protect ourselves. They're hard to do, but you got to do it. And so, I've got to report some numbers, because when these numbers came out today, I think Dr. Marsh and I both looked at one another like, dag. On the number of cases that are positive versus the number of tests done by the number of cases that are positive. Just imagine this in pretty much all the other states, and this was the president's reporting, or maybe it was his right-hand medical official that was reporting. But in most all of the other states, you're running at a percentage basis of about 8 to 10% across the board, all throughout our country. So the number of tests taken and the number of positives, 8 to 10% across the board. In New York today, we're running at 30 to 50%, of the tests taken that are running positive. In West Virginia, we continue along at 4%. We've had 126 positive cases reported now, and we are trending at about 4%. Now, really and truly, if we can keep doing that, we're going to be the model. And to keep doing that, we have to continue to heed the information that we've been telling everyone. We've made the right moves thus far, but we are a state that is extremely high risk, and we have got to continue to do the things that we've been telling you. Stay at home, wash your hands, keep your hands away from your face if you possibly can. Absolutely don't be in a crowd whatsoever, especially don't be in a crowd in excess of 10 people. So there's all kinds of different things, and absolutely I ask all West Virginians, all families, to pray for this victim and all their loved ones that we lost. So now, also today is National Doctors Day. Today is National Doctors Day in the United States, and I have proclaimed it to be that in West Virginia as well. You know, these are the people that run to the fire. These are the people that we've got to protect so much. All of our healthcare workers, in every way, shape, form, or fashion, we've got to protect them all. You know, and I don't know how to talk to you in words other than just talking from my heart. I'm not a politician. I'm going to always just tell you the truth. You'll never catch me in a situation where I've told you something that's not the truth. I'll make mistakes, but I'll never purposely in any way tell you something that's not the truth. We need to absolutely appreciate all that healthcare community in every way, but not only that, we have got to preserve that healthcare community. So we've got to protect them, we've got to recognize them, we've got to appreciate them, we've got to salute all of our doctors today, and absolutely whatever we do, we have got to keep that healthcare community from getting sick. If we get them sick, we're in big trouble. So that's going to involve a lot of stuff that's going to be reported to you today about the progress we're making on all the supplies that we're pushing all over the globe. Additionally, I want to do 2 or 3 more things here. First of all, today I am announcing that all state park campgrounds be closed. All of this is driven primarily from the standpoint of others coming across our borders that we don't want them to come. Now, we in West Virginia want to embrace all and have people come from all walks of life when this is over. But right now, we don't want you to come, and we want you to hear us. We don't want you to come across our borders. We're also closing the Blackwater Falls Overlook and the Cooper's Rock Overlook. And it's just simply because we have a stairway at Blackwater Falls, and absolutely we're congregating crowds. We've got to close those. Today, I am also issuing an executive order that basically does just this. I am directing anyone that's high risk, that is coming from a high risk area, such as Louisiana, New York, New Jersey, Connecticut, Italy, or China. Any of those people that are coming here, I absolutely am issuing an executive order that you quarantine yourself for 14 days. Now, I am also announcing the closure of our state park campgrounds, and I am also instructing our West Virginia State Police, as a directive from me, to monitor this situation. And so therefore, what I'm really saying to our citizens and everyone, that if there are people that are coming here across state lines, first of all, we don't want anybody coming here from across state lines, unless you're doing something that you're commuting back and forth, you know, from an essential business standpoint. Other than that, we don't want people coming across our state lines. Now, but if you're coming primarily from New York, New Jersey, or Connecticut, and you're coming across our state lines, you have to be quarantined for 14 days. And absolutely, I expect our state police, and I'm directing them, that if there are folks that have come across state lines and they are not quarantined and everything, that some way, somehow, we've got to be able to get word to them that that's exactly what they've got to do. So, I guess that's enough for one day. Again, I tell everyone to follow the guidelines of that we've outlined, and please stay the course. We are absolutely doing it in a good way today, but this monster can turn on us and turn on us in a bad way. And the reason this monster can turn bad is just as simple as this. We're an old state. And the people in this state, and by old, I mean we're an elderly state, the most vulnerable of all. And so we have got, and in addition to that, we've got a lot of people with chronic illnesses. This thing can get ugly and get ugly really fast. We're on top of it right now. We're trending the right way. Please stay the course. please just stay the course. We're going to get through this. But anyway, I'll turn it back over to Jordan and all of our other people here.
Thank you, Governor. As part of our briefing today, our friends with the media are once again joining us by teleconference. We'll be taking their questions in just a moment. But first, we're going to take comments from a few of our panel members. Up first, Dr. Clay Marsh, our coronavirus czar.
Thank you, and thank you, Governor, for those comments. I think that's really, really critical. We are doing really well. Now, I think that the danger in saying that is we don't want to curse ourselves that all of a sudden we can let up and be complacent. But as the governor said, if you look at national averages, this is other states in the country, they're running at 8 to 10% of positive tests to total tests. New York, 30 to 50, and we're running 4. That is something to really take a moment and be proud of, because to me, that's a direct reflection on the commitment of each one of the citizens of our state that are making a personal commitment to doing things to protect them, protect their families, protect their communities, and as the governor said, protect our healthcare workers. And I join the governor in congratulating and thanking our doctors on National Doctors Day, but I also want to extend that to our nurses, to our other healthcare workers, to our essential workers, to people that are on the front lines, our first responders, the people that go and run toward the fire, as he said, are the heroes of today. And what we want to do as a state is to protect them, because again, we know that if we do all the right things and we reduce that surge by staying in our homes and doing exactly what the governor has instructed us to do, then we are going to make it through this. And if we can do that at 90% level for people in their communities, we'll do it just fine. And so I think that we've done great, and people are very much committed and responsible, but we need to keep it up, and we need to make sure that we are holding our neighbors responsible for doing this too. And this is not just a sprint, this is a longer race. And we are the state that is the only state in the country right now, in my opinion, that has the ability to turn this from a potential crisis and disaster to make it so that we can live as we have enjoyed up until the coronavirus crisis. And I want to say one more thing. So you could ask the question, so why is that so important? Why is it so powerful to stay in our homes and to stay socially distanced and to wash our hands? And so importantly, to keep our hands away from our face. The virus thrives on us introducing it to our mouth, to our nose, to our eyes. Make sure you wash your hands. Keep your hands away from your face. If you need to go to your face, use a Kleenex or something between you and your fingers, but also wash your hands. But the reason why it's so important is the simple principle of compounding. And so we know that if somebody puts money in the bank when they're really young and then stops after a little bit and lets it go for a number of years, they end up with a ton of money. If you start later in life and you invest a lot more money, at the end of the same period of time, let's say that somebody invests for 5 years when they're young and 10 years when they're older, the money that gets to stay in that stock market account will generate a lot more money, and you'll have to put a lot less money in. Well, the virus does the same thing. So let's remember South Korea. South Korea is a very good country for testing and making sure that they're keeping the people who are positive quarantined. And so the first 30 people in South Korea, they did it perfectly, and they didn't get spread of the virus. But the 31st person escaped their detection, and that person personally led to over 1,000 people being infected with the virus. And the reason why is because the virus doubles its impact every 6 days. So in 60 days, 10 doubling times, if a person with the virus infects 2 more people, and the virus generally infects 2.5 to 3 people, but for the purposes of this mathematical exercise, so if a person with the virus infects 2 people, then those 2 people infect 2 more people, that's 4, and then 8, then 16, and 32. Within 10 doubling times of the virus, that's 60 days, that's 2 months, the one person with the virus will have infected 1,024 more people. If you wait and that doesn't get broken by staying in the house or separating, and the virus keeps going forward, that one person in 10 more times, which would be in 4 months, would have infected 1 million people. And if that doesn't get broken in 2 more months from then and 6 months from the very beginning, that person with the virus will have infected 1 billion people. So the reason why we're separating and staying in our homes and washing our hands, we're breaking that compounding cycle of the virus. And people in West Virginia are doing an amazing job. Thank you. Thank you. You're doing it. You're making a difference. We're beating the virus, but we can't stop. And as soon as we stop and say, well, the weather's nice, we'll get out, we'll do things together, then we're going to have the same trouble that New York City does. So keep it up, stay strong. I'm really proud of what West Virginia is doing, but this is a long-term game that we need to stay in. Thank you.
Thank you, Dr. Marsh. Up next, Major General Hoyer with the West Virginia National Guard.
Good afternoon. Today we have 350 National Guardsmen on duty. We have 2 personnel in Ohio County today working with the Emergency Management Office to address some minor flooding that has occurred there. We continue to work the efforts with the prototype mask so that we can potentially make masks here in West Virginia on our own. We are working also with the network of folks who are out there making masks now. As the governor pointed out, our effort is towards protecting our healthcare workers and other key essential personnel, but we want to make sure before we would go into any large-scale production, we would make sure that we have the right mask and the right filters in place. So I ask you to be patient with us on that effort. We started testing support for drive-thrus in Huntington today. Tomorrow, we begin working with retailers, with convenience, as well as restaurants on additional sanitation and hygiene training and decontamination training for supplies that are coming in from around the country. We also have distributed 7 refrigerated trucks to help with the food supply effort for our children, and additional soldiers to work with the second food bank to help with our efforts there. In addition to that, we continue to work the supply chain issue, trying to source worldwide. We do anticipate a shift from FEMA, from the national stockpile. You'll get more information on that as it comes out later today, and more detailed information will be provided in the National Guard roll-up at the end of the day. In addition to that, we also are receiving from Dow Chemical 40,000 pounds of hand sanitizer that will be distributed over the next several days. And we also have our 7th team in place, the epidemiological effort that's going on. And today, one of those teams delivered a key specimen for an acute care patient to the state lab to improve the timeliness of the test result to address that for that individual person. The last thing I would leave you with is, over the past several days, Governor Justice and our 2 United States senators have worked very hard to do 2 things for us. One is to help us get additional waivers from U.S. Department of Agriculture to help with our food feeding program for our children. That was received this morning. In addition to that, over the next 48 hours, we believe we will have a new funding initiative in place to federally fund our National Guard personnel and give them additional protections through a federal duty status. And we as the Guard greatly appreciate that. Last thing I would leave you with is, on behalf of the Guardsmen, as the governor and Dr. Marsh have pointed out, those who are out there on the front lines, we greatly appreciate those citizens who are paying attention and working through this with us so that we can break the chain on this virus. Thank you.
Thank you, General. Up next, Secretary Bill Crouch and Dr. Cathy Slemp from DHHR.
Thank you. This is Bill Crouch. I just want to say thank you to our essential workers and remind them that they are really the ones that are out traveling. If folks are out now, you'll see very few cars, very few people on the streets. But these are the folks who are taking care of services that need to continue. But you're also the ones out there that if you have symptoms, if you develop a fever and you develop a cough, please stay home, call your healthcare provider, because we want to keep you safe out there as well. So we thank you for what you're doing.
I'll speak briefly to epi investigation and to lab testing. The Office of Epi and Prevention Services with the both WVU and the National Guard are really working on developing a more public-facing dashboard that has more additional data available to you. We actually have some analysis already done of testing data and positivity data as of 10 o'clock last night that you'll see posted on the website as a PDF document this evening, is my understanding. And I can speak to some of that here if you'd like to, moving forward, if there are questions on that. We have, as General Hoyer mentioned, the public health regional epidemiologists with National Guard teams of 4 have been deployed to 6 regions to support local surge capacity for outbreak investigation and contact tracing. So they are working together as a collective public health system. In terms of labs, we are, as you know, there's rapidly changing lab technologies becoming available around the country. And so we are working with a team at a strategic level to assure 2 things. How do we best diversify the systems across our clinical diagnostic laboratory network so that we aren't caught by individual reagent shortages with any one technology? And then how do we best acquire and utilize some of the new rapid point-of-care testing, both for field and outbreak investigation purposes and also to maximize our workforce's ability to get back to work for essential service employees when they are ill. Last thing is a thank you to Marshall University, who has very nicely manufactured for us viral transport media that's going to begin to expand our ability to send out testing viral transport media collection kits to communities to support the outbreak investigation and work that's underway. So thank you.
Okay, thank you. Once again, we're holding today's briefing with the media members joining us virtually to practice good social distancing. To ensure all outlets have an opportunity, we ask the floor will be given for 1 question on our first run through. Depending on time, follow-up questions may be permitted. To media members, when we call on you, please remember to unmute the microphone on your end before asking your question. Please confirm your name and affiliation as well. Today, some media members will be asking their questions through video chat. The first questioner today will be Stephen Allen Adams with Ogden.
Yes, Stephen Adams, Ogden Newspapers here. Could you go into more detail about the conversations that you had with President Trump and Vice President Pence earlier today? I know a number of things are being discussed. 4th package, the issues facing state. Could you go into more details about that? Any more details about supplies?
Okay, Stephen, I got, go into more details about my conversations with President Trump and Vice President Pence, but then it broke up. Tell me the rest of your question, please.
That's basically it. I specifically pointed out the fact that there's issues being talked about in regards to a 4th coronavirus package. And an additional question on top of that, you're talking about the self-quarantine for people coming into the state. How is that going to be enforced?
Okay, well, let me get, I didn't get the part about the package. No,
the package was...
The package part was cut off. If you do that one more time, I'm sorry. The
2 questions.
Okay.
Question number 1 is about what the president and the vice president are talking about this morning, particularly in regards to a 4th stimulus package that's being considered. And also, how would you enforce the self-quarantine that you just talked about?
Okay, I've got it now. Okay, from the standpoint of the self-quarantine, here's what I would hope would happen. First and foremost, I really want everyone to understand that if you come to this state from New York, New Jersey, or Connecticut, we expect you, point blank, to quarantine yourself for 14 days. Now, if you come here and you choose not to do that, and we find out about it, we're sure going to ask our state police to check in on you. Now from the standpoint of our state police running and arresting them and everything else, basically if the state police goes to them and they as I understand, and I think Brian, you could come up and maybe finish the rest, but as I understand, if the state police goes to them and says, you have to quarantine yourself for 14 days, and they refuse to do so, then they're basically obstructing. And so the net of the whole thing is just that. Our state police can go to them and request that they quarantine themselves for 14 days, and if they resist, they're obstructing justice. That's all there is to it. Now, as far as the other thing, you ask about a fourth phase of the stimulus package. Well, that's still all up in the air. But what we all need to do is know just this. Our federal government and our state, but especially the federal government, is trying to make us whole economically, especially the workers. But as far as small businesses, they have packages that are designed in a lot of different ways. And I'm going to misspeak a little bit in this because maybe I'm a little bit off on one thing or another. So I would highly encourage all the people that are involved in small businesses to look at this stimulus package and dissect it in every way. In addition to that, we're going to have our people here put out our, basically all the results of what we think the stimulus package is going to do. And then right behind all of that, we're going to have people here that can answer questions and direct them in the right way. The bottom line of this is there's many, many, many tentacles of this stimulus package, and it works a lot of different ways and everything, but the net of the whole thing is just simply this. The one thing that's right off the top that I believe is available is if you have a payroll, you're expected to be able to draw money and pay that payroll and draw that money at a rate of 2.5 times what your payroll is for 8 weeks. And then that loan will be 100% forgiven. So like I said before, there are so many different facets of it. Don't absolutely run to the bank with exactly what I'm telling you here, but I am telling you the government is trying to make us whole, and the government fully realizes that a phase 4 may be necessary.
Okay, thank you, Stephen. Up next, Mark Curtis with WOWK.
Governor, Kanawha County Commission President Ken Carper is asking you to not hold the May 12th primary, at least the in-person voting. He wants it all done by absentee ballot. He's concerned that with 9,000 poll workers in the state in polling places that are very confined spaces with a lot of voters, you're putting a lot of people at risk. And so he wants to see the May 12th primary delayed or scrapped entirely and just do it all by absentee. Your thoughts?
Well, I would only hope this. I would only hope that that opinions that come in are not politically driven. But the other thing is, believe me, we're on top of and very aware, of poll workers, and we're not going to endanger anybody, or we're surely not going to try in every way, shape, form, or fashion to not endanger somebody. But with that being said, we are very aware, and with the president extending till April the 30th, because the wave was moving like maybe in parts of this country, not necessarily West Virginia, but in parts of this country, we're going to open back up at Easter. I thought that was ambitious and everything, but with all that said, with the new approach that we're going to be shut down until the end of April, with a primary, less than 2 weeks away, we're considering all options at this point in time, and we'll let you know very soon, from the standpoint of the possibility of an extension.
Thank you, Mark. Up next, Phil Kabler with the Charleston Gazette-Mail.
Talking about the new testing alternatives, have we looked at the Abbott 10 Now test and regarding the availability and use of that?
Clay Marsh. These technologies are rapidly evolving, and certainly we see this point of contact test that would be positive in about 5 minutes and negative in about 15 minutes as a great new addition to the armamentarium that we have. Certainly, as Dr. Slemp talked about, as we are trying to follow people and make sure that we are identifying who's positive and who in their control group may be positive, their contact group, this kind of field epidemiology test kit would be very important. And if we do get to the surge of the COVID patients in hospitals, which we hope we can avoid, but then it'd be very valuable to roll this out around healthcare workers who may get symptoms. But this is something that we are very excited to add to our armamentarium. But this is a single tool, and what we want to do is expand the capacity that we have using multiple different tools. Because one thing that we found is everybody has tried to expand testing so dramatically. And remember, countries like South Korea and Singapore and Italy are like states in the United States. We're so much bigger that having multiple different kinds of testing platforms from different companies allows us to continue to get the supply of the supplies that we need to be able to use those platforms effectively. So being able, if one company runs a little bit low, have another company where we can get the material is important for us to balance our hope to really expand testing for all West Virginia.
Okay, thank you, Phil. Up next, we'll go to Anna Saunders with WOAY.
Hi, Governor. It's Anna with WOAY. This is just kind of going off of the 14-day quarantine for the out-of-state visitors. If an out-of-state visitor were to come into one of our hotels, will the front desk worker then have to order them to go into quarantine? How will that exactly work?
Well, I think, Bill, you want to try? I mean, I go ahead. Go ahead. I'll follow up.
I missed part of that question. The 14-day quarantine period. Can you repeat that quickly, please?
Sure. Just kind of in terms of enforcement, like let's say an out-of-state visitor were to come into one of our hotels asking for a room. Will the front desk worker then have to tell them to go into 14-day quarantine? How will that work?
They should. I mean, that's an executive order now by the governor. We want that made to everyone that comes into the state from out of state made aware of that, and we want them to honor that. We're trying to protect our citizens, and we're doing a great job. Our citizens out there are doing what they need to do. We want to keep this virus out of West Virginia to the extent we possibly can.
And my follow-up on that would be the the traffic that's moving through from the standpoint of our trucks or whatever that are moving through. We surely don't want to be restrictive in any way, shape on that. You know, so all that moves, and that's not what we're referring to. We're basically referring to people that have tried to escape out of a very, very, very toxic area, a hot spot beyond belief, and come to West Virginia and enjoy all the goodness that's going on here and hang out, and they may very well be affected, not know it, and come here and affect lots and lots and lots of people here.
Okay, thank you, Anna. Up next, Amanda Barron with WSAZ. Looks like we may have dropped Amanda. We'll go next to Anthony Izaguirre with the AP.
Sorry, technology. Can you hear me okay?
Amanda, we've got you. Anthony will take you next.
Okay, my question is, as far as self-policing is concerned, if you see a large group in your neighborhood, kids out playing football, kids out doing different things, family gatherings or neighborhood gatherings, people are not going to feel comfortable to walk up and say, hey, you guys shouldn't be doing this. What recourse do people have? Who can they call? How can you check in to maybe say, you know, people aren't practicing social distancing in my neighborhood?
My comment would be this. If you're uncomfortable with doing this, that's not wise. That's just plain not wise. You know, granted, a lot of people are uncomfortable all the time. Uncomfortable about running to the fire. Uncomfortable about seeing an accident and don't want to get involved, so go on by. Well, this is a train wreck that absolutely, if we have gatherings, somebody needs to speak up. That's all. Somebody needs to absolutely be the adult in the room and speak up and say, we're not supposed to be doing this. Let's get away from each other. We can still enjoy one another, but for crying out loud, let's get away from each other. And we're not going to be able to monitor every single person and everything that's going on all the time. And our people are doing good. Our people are doing a good job, and we should not be offended when someone is trying to look after the well-being of all of us. So that's my take, but you guys.
Yeah, and this is Clay Marsh, Amanda. I think that's a really important issue. You know, I've been more of focused on social media than I usually do, just because of the trying to see what people are thinking and answer questions. And this weekend there was a lot of activity in stores and perhaps outside. So I think that we need to hold our neighbors responsible too. And I think that's what the governor just said. But we also want to try to create the pressure, social pressure from other people in our community that make people understand that you're not just being selfish yourself, you're potentially hurting others in the community, and you're potentially hurting our healthcare workers and other essential workers and first responders. So I do think that perhaps we should start to drive a campaign around sort of personal responsibility, much that we've done with smoking and other things. So I think that's a good idea, and that's something we can work on.
Can speak to the fact that as we do cluster investigations, we have a situation or so in a community in which there was a gathering, and again, this was right around the time things were shifting. But a couple weeks ago, there was a gathering through a church-related situation. We have had several individuals being positive through that. So it speaks again to the importance of not having those gatherings. We're seeing that occur when it happens. Now, this was around the time that things were changing, but that's important to kind of reemphasize, yes, this can occur with these large groupings. And again, reiterating things across society that we have to not be having these group gatherings, and within churches not worshiping in traditional ways, finding new ways to do that.
Okay.
One more thing too. I think as we move forward in the future too, you know, adapting a few of these, you know, new needed ways of living, you know, to where we're washing our hands more and really watching the contact with one another, it'll have a profound difference in the flu. It will have a profound difference in our wellness in many ways. And we can surely still embrace and do all the good stuff we do, but at the same time, you know, we need to really take heed of this, and it will not only help us now, but it'll help us in the future.
Can I just make one more comment, then we'll get to the next question. I think it's really interesting to review what happened to New York City and San Francisco. So on March 19th, they both had the same number of COVID positive people. San Francisco went on a stay-at-home order and did exactly what our citizens are doing now. New York did not. 6 days later, San Francisco had 1,023 positive, COVID positive people. New York had 15,000 COVID positive people. So this impact of this compounding time is so powerful. So Amanda, I think what you're asking is so important, and we would all implore our citizens to really pay attention to that, because it makes a huge difference. And as the governor said, it will make a huge difference in many, many ways for our health.
Okay, thank you, Amanda. We have time for one more question, and that's from Anthony Izaguirre with the AP.
Can you clearly explain what the state police will be doing under your executive order? And are you worried that having police stop someone on the basis of their license plate could be unconstitutional?
Can you explain what the details of the executive order? Will police stop people with the license plates from out of state? Anthony, is that correct?
Brian, come up. Maybe you can give this a little bit better, you know, from the standpoint, you know, okay, go ahead.
Okay, so the executive order makes allowances for interstate traffic. It makes allowances for those workers that are coming into West Virginia to work on essential services. And it makes allowances for military, health care, and et cetera, et cetera. So we don't anticipate there'd be any interference with those activities. Most of the contact here would be when someone is coming into the state from out of state and they take up some kind of residence or they're at a location where the police are made aware they've been there and intend to remain there, and they're not abiding by the quarantine. Then we would expect law enforcement to make contact with them and remind them about the self-quarantine provisions the governor's put in place.
Well, again, to end it up, I would just ask, as Cathy and I have done, but I would ask your prayers for the person that we lost, and I would ask you to stay the course in every way. Our president and vice president today outlined a lot of different stuff. You know, there is a shortage of protective supplies. It is a nationwide shortage, which every governor is, or every person is screaming for you know, protective materials and supplies, and we're making real headway there, and we're finding sources that are not only from our federal government, but sourcing the whole world. So with all that being said, every day that goes by, every day that we stay at 4%, we're getting better. Please stay the course, and please listen to all these great health officials because they know what they're talking about and everything. We've pushed the right buttons so far, and let's just keep on pushing the right buttons as West Virginians, and I thank you. I thank you from the bottom of my heart for all that you're doing. I know it's a terrible inconvenience, and I apologize in every way for that. And the other thing is, I want you to really research and look really hard at all the stimulus packages coming and all the economic ways that you can be made whole. And we're going to do the same thing and supply that information to you. But thank you again, and God bless, and we'll see you tomorrow.